Hello, everyone, and I'm Katie, and welcome to IAmPreeminence, and this is our space. And today I have the beautiful Afia Frimpong with me. I love her so much. Afia is actually a public health professional, and she's committed to serving her community. She's a strong advocate for women, for maternal and infant health. She's actually a doula. Okay, and as a full spectrum doula, she's committed to ensuring that women of color receive the health equity that they're due during and after birth from their healthcare providers. So, Afia, oh my goodness, welcome to the platform.
You made me sound so important. Thank you.
Because you are. Oh my goodness, don't start.
You should be a news reporter. You're great at this.
You guys, Afia is a part of our family. And we are so very proud of her. And she's working, she's a new mom, and she just does so many different things. She's educated, she has a master's degree, and I'm pretty sure that we can learn something from Afia. So Afia, let's get started. Just tell us a little bit more about your journey, how you even became a doula. Were you always on track to be a doula? Just let us know a little bit about your journey so far.
Thank you. Thank you for having me.
You're welcome.
So first question. So talk a little bit about my how I got into public health. So at first I was originally pre-med, typical African, go to college, become a doctor, right? And I went to a hard school. I majored in psychology and I minored in, and I was on a pre-med track. And it was just hard. I got to Orgo and my grades started going down. And I was like, time to think about other career paths because, to be honest, the way pre-med students and engineers, science students in general on my campus were going so hard, I knew I was not giving it on my all. So I needed to figure out what I wanted to do in my life post undergrad. So I remember once I was at this 3-year summer internship at Columbia, and someone came in and started talking about public health. And I was like, oh, I've never heard about this part of healthcare because, growing up, all you know is doctors and nurses, right? The basics. And then they started talking about public health. And I was like, oh, okay. Don't really care about it. I still want to be a doctor. And then when I went back to school, my last year of undergrad, they had these public health courses offered at my school, like Intro to Epidemiology, Intro to Public Health, and I enrolled in both of them. And I did really well in those courses and I enjoyed it, most importantly. So I was like, oh my God, let me look into this. What is this about? So I started looking up programs, public health programs, and they had a master's degree for it. So that's how I kind of got into the whole public health thing. At first, originally, I went into grad school doing community health at SUNY Downstate. And then I picked up health policy and management because I took an intro class and I was like, oh, this is really interesting. I definitely see myself doing something like this. So I decided to do a dual concentration in community health, community and urban health, and health policy and management. And I went on to work at the health department. I was working on a whole bunch of health topics. And one of the topics that, of course, came up was breastfeeding, right? And infant maternal health and women's health. And I was like, okay, so we were pushing a lot of that, learning a lot of stuff about how Black women were dying at childbirth. I didn't know anything. I didn't know any of this was going on. I didn't know that Black babies are least likely to live even to see the age of 1. And I'm like, what? Right? And certain things you don't think that you can relate to it because you haven't experienced it. But then I started talking to people in the community. I was working in Brownsville and it was real. Like a lot of African American women, we have miscarriages, right? And it's like, I just became very intrigued, and the story became very personal to me when actually my cousin had given birth, right? And she ended up, of course, having a C-section, and I felt like her whole experience was a bit weird. I was there the whole time, and I realized the conversation she was having with her doctor, and it just felt like she didn't have options. It was just kind of like,
Yes.
the doctor came into the room. This is what's gonna happen. This is what's gonna happen. So when I was working at the health department, one of our partners, Brooklyn Perinatal Network, the organization that actually assisted me in becoming a doula, they were having trainings. And I decided to get trained to become a postpartum doula at first, right? So helping mothers after they have birth. And then I got into the birthing work. The birth training came up, and I decided to do birth as well because I want to be in the room when the moms are giving birth, right? That's where they actually need the advocacy to be able to decide how they want their birth to be, because sometimes they're ignored because so many things medically and clinically is going on around them. And then I furthered on to become a lactation counselor. DOH had, assisted us in training me to become a lactation counselor so I can be able to educate women on how to properly breastfeed if they're having any challenges and educate them on the importance. So that was pretty cool, right? All these trainings, right?
Yes.
But most importantly, it allowed me to become a voice in my community. And now as a new mom, I respect what I do even more, right? Because when you're given education, it's all textbook, right? But when you're actually in the shoe of the client, it's like, now you understand why clients sometimes don't want to take your advice or why they appreciate you so much. Like, you kind of become that thank you person. Now, I had a doula when I gave birth, and I love her so much, because even though my birth didn't go as I planned because of medical reasons, I still love the fact that I felt like I wasn't alone, right? Like, she was there. She was even so happy how I was able to advocate for myself, during the process of me staying in the hospital. She was like, this is great. Like, this is what clients are supposed to be doing. And it also instilled in me that, like, it even pushes me more to basically kind of like let my clients know that you can be your own advocate. Doulas are great, yes, and we're there, but you can also be your own advocate. Look for that healthcare provider who will allow you to have your own voice and try to accommodate the birth that you see yourself having as much as possible. So it's definitely been a journey. I'm grateful. I love talking about this. I feel so knowledgeable about it, and I continue to educate myself on the topic because it's changing. The world is changing. Healthcare is changing. And Black women are precious. We're gold. Like, we deserve to be here. And that's really what's most important to me, that we make it out of birth safely, and take care of ourselves and take care of our children.
I mean, I absolutely, I love this topic.
Yes.
Because I too was on a pre-med track. I wanted to become an OBGYN. I was very into maternity when I was in nursing school. So for me, it was very important to have you speak about this, not just because of explaining what a doula is or whatever, but it's the heart of us as a woman, because you've raised or you've protected this tiny little being until it becomes a human life form, and then you never even get to hold that child. Now, let's talk a little bit about how a woman or a young woman and an older woman, a woman who's about to give birth, how does she go about advocating for herself during her pregnancy and also during labor, which is very challenging.
Number one, get a doula. And I'm saying this because many people feel like, oh, they have a supportive partner. That's great. Oh, my mom is gonna go. My husband, my boyfriend is gonna go. That's great. But sometimes you need that third party to come with you in a hospital that's non-biased, right? Doesn't really have that like years of relationships with you, right? To step in there out of their comfort space and advocate for you, right?
Mm-hmm.
Number 2, have a birth plan, because your doula will have that birth plan as your Bible as you walk into that labor and delivery, to make sure that everything you guys have discussed is written down on papers, so that you can give it to the provider on site to let them know, hey, this is what the client wants. And if you feel like your client is going to be giving birth at a hospital that may not respect her wishes, a doula can help you find a hospital that will, because it's really serious. It's truly serious. I'm sure people have, been in tune with the news and hearing how locally young women, very young women, have been passing away from having a baby. Popular to, common belief, like, that's not normal. It's not normal for a young woman that is healthy to give birth and then suddenly pass away. But it's happening so much, and it's not always reported. And that's the scary part. That was the scary part for me. I remember going into my doctor office, my visits every couple of weeks, crying, telling my provider, I'm scared. And then, already being African American, we're predisposed to so many diseases like gestational diabetes, hypertension, all these stuff starts to pop up or can pop up in pregnancy. And it's just like, it makes you even more scared. I think it's the fear. So definitely having a doula, having a birth plan, so that you can be at least prepared, right? So birth is unpredictable. You walk into labor and delivery and you don't know what's going to happen, right? You expect to go in there, bam, you're going to take a couple of hours to push your baby out. But that's not every woman's story.
Mm-hmm.
God, I prayed it was my story, right? Because, Katie, really, my pregnancy was chill. I was chilling, right? I was like chilling. And then all of a sudden, creep up 32 weeks, 33 weeks, 37 weeks. All these things started to happen. And I'm like, oh my God, like, no, this isn't happening to me. Like, I'm a doula. I know all this stuff. But like I said, it becomes real.
Mm-hmm.
And most importantly, I would say if you're doing family planning and you're thinking about becoming pregnant, I definitely something that, I wish that I was even able to do is make sure to get a physical, make sure you're healthy, make sure your body is healthy, because pregnancy takes a toll on your body. And just being able to make sure that, health-wise, you're good, so you can avoid any complications or any health issues that might come and can probably even last for the rest of your life after you give birth is important. And I feel like it's another thing that is often not even talked about. All you hear is like, oh, I'm pregnant. But nobody ever talks about family planning, right? The stages to getting to pregnancy, making sure that you're healthy, and making sure that you're fit in order to carry this precious life. So definitely doula and birth plan are 2 important things. And birth plan, even if you decide like, okay, maybe the whole doula thing isn't for you, that's okay. Go online, Google birth plan, and there are templates of birth plans there. And when you go to your visit, have it completed, give it to your physician, go over it with them, and let them know this is the type of birth I envision. If this doesn't happen, this is okay. If this doesn't happen, this is okay. This is who's going to be there with me. Definitely look for a provider who advocates for you to have that type of support. It's out there,
Mm-hmm. And then let's talk about women who, now that we're discussing it, may want a doula, right? Because before you became a doula, I was, not that I was unfamiliar with a doula, but I just thought that you had to be of a certain tax bracket to be getting doulas and, birth plans. And, I just thought you're pregnant, you take your prenatal vitamins, you're your husband, you don't lift up heavy stuff, and you go have a baby, you get flowers, the family comes over, you have to learn how to breastfeed, and that's it. So really, truly, there's a lot more to it.
There is so much more to it. Mm-hmm.
Having a doula is such an integral part of your journey as you deliver your baby. How would a woman, we're in New York, but guys, doulas are all over the world, okay? How would a woman in the United States, because that's where we are, you know, you can research it in your own country if you're not watching from the United States. I know you got people from the islands, they have midwives. It's so much more common there, actually, than it is here. We're a little backwards. But how would they go about getting a doula?
So doula is really just a support person, right? It's a fancy name that all of a sudden now they've thrown out there. But the work of a doula has been going on for centuries. You mentioned the islands. I know in Ghana, right? If a woman is about to have a baby, local woman from the village, right? They come to the woman's house, her room where she stays, right? You set it up for birthing, and the woman stay in that room with that pregnant mother who's in labor until she gives birth. They take care of her during labor and after labor, you know, make sure all the blood and the placenta, all that stuff is out, all without medical tools or any of that, right? And all those women they're acting as doulas and midwives, right? And I'm sure they have no formal training or any of that, just years of experience of helping each other give birth to babies in the village. So what I would say in regards to the United States is, if you're looking for a doula, and of course, as you said, white women, they pay ridiculous amount of money, right, for doula service.
Yes.
But what I would say to do is just do a search, right, for free doula services, and you will be able to see if there's even that option. I'm not well in tune to know if there's free doula services all throughout the United States, but what I can speak of is right here in New York City, and even the program that I work under, Brooklyn Perinatal Network. The program I work under with BPN in short terms is Healthy Woman, Healthy Future, and we offer free at no cost to you doula services, and we have some great doulas who are like businesswomen. Like, I'm telling you, besides doula work, they're out there at, like, you know, City Hall, talking to the mayor, working with local hospitals, making sure that providers know what doulas are, letting them know that we are in your hospitals, right? We check in to let them know, hey, we're on the floor, we're helping women give birth, so that not only are, you know, the clinicians are comfortable knowing that, hey, there's kind of like we don't want to say third eye, but like, this woman is here and she has support, you know, so make sure like she receives the best care possible, as, you know, somebody who another type of person. You get what I'm saying? Mm-hmm. So again, Healthy Woman, Healthy Future, shout out to my program. We offer free services all throughout the 5 boroughs. So depending what borough you live in or where you're delivering, we will match you with a doula who lives in your area, preferably kind of like your zip code, so that visits are more like easy, you know what I'm saying, and more frequent and often both for the doula and the client. We tend to visit our clients 4 to 5 times before they go into labor and delivery. We're there with them through labor and delivery, and postpartum, we do 3 more visits to make sure that you're okay. And then we have the postpartum aspect, which is 21 hours of service. So what postpartum is, you come home and now the baby's in your hand, right? everything happened. Now the baby's in your hand, and you're not getting enough sleep. You're not eating. You're not cleaning the house. So what postpartum doulas do is that we come home, any difficulties that, you know, you might face with breastfeeding, we're here to support you or refer you to the right services. Any light cooking or light cleaning you might need assistance with in the house, we come and help. If you have other children, you know, we kind of keep them entertained so that you can attend to the newborn that you have. Or if you don't have any children and the newborn is your first child, then maybe you might need a nap. You have not slept in hours. We can come, you know, make sure that the baby's okay and you can get some rest. Or, you know, if you have some house things that you need to do and focus on, you can do that while we kind of like make sure the baby's okay. You kind of create that type of relationship or assistance that you need when it comes to postpartum services. So definitely, I would say just Google is like the it of everything, as everyone knows. And there's a lot of resources on Google. So you can look into that. Or even ask me. I'm always finding out new things. Like just recently, I actually found out where I went to college, University at Buffalo, there's a doula service up there. And I never knew that African-American woman, she started her own business and it's a doula service, free. And I've had so many classmates who are giving birth who are interested, in me servicing them. And I don't even live upstate anymore. But now I can refer them to that service. So one thing I'll tell you is that doulas are a great tool in regards to resources. We're in tune with our community. Like, it's our job. We need to know what's out there so that this is what it means to properly serve our women, to serve our community, knowing what's out there, right? Because again, Google is great and all, but sometimes it's good to know somebody that knows somebody, right? Yes. So that's what we are there for. And if I know personally, I don't know it, I know who to ask to find that information out, because I know there's somebody out there who knows more than me. Mm-hmm. So that's how it really works. Like you share the love, you share the knowledge, because it's a community. That's the only way we're going to be strong. We're going to grow and be strong, is if we're there for each other and we share our resources.
So Afia, please let us know, what are some of the misconceptions that people have about a doula?
A doula is not a midwife. We are not clinical support. I think that's probably the biggest misconception, that we're clinical support. We don't deliver your baby. We are literally there to coach you. So consider us to be a birth coach / advocate. And this is important because I feel like sometimes people get confused what our role is. Mm-hmm. We're not medically trained. So there are doulas who are nurses, and even the doulas who are nurses, you are told don't practice as a nurse, because when you're practicing as a nurse, you have insurance to back you up, right? Doulas, our insurance is a bit different. It's not the same as one of a clinician or medical provider. So I would definitely say that, people misunderstanding what our role is. We are really there to just be kind of like a sister in service. While you're going through your journey of pregnancy, labor, and delivery.
Okay. And then you were a doula before, the pandemic happened. How has your experience been as a doula pre-pandemic and now, well, I can't even say post, we're still in the pandemic. So how has it been?
So I think what I would definitely say is that it was already hard for us to do our work in the hospitals. And in the beginning, before, Cuomo passed that bill that doulas are support people and they are to be let inside and assisted by mothers on top of an additional person. Like, when COVID started, it was kind of, no doulas can't come. No doulas can come. Of course, what probably some of these hospitals wanted. But as soon as that bill passed, and of course we fought. What did I say? We fight, right? We said there were many advocates out there saying nope, a mother is not going to go into the delivery room and have that baby herself, because not every woman has somebody to go into labor and delivery with. Yes. So that's why it was said a woman is not to give birth by herself. Imagine you never given birth and you're told to push by yourself with nobody in the room. Just imagine, but how many women have done it? That's even the scariest part. Mm-hmm. Right? We mentioned the unknown and not knowing what's going to happen. You're already nervous. You're already scared. And then a pandemic is happening. People are dying. You're afraid to be around people because you don't know if you're going to get sick. Mm-hmm. And then boom, your baby is coming. So literally it's just been like a high level of anxiety, Mm-hmm. And I would definitely say that, like I said, just again, maybe feeling comfortable to do your work in the hospital, because people are just kind of sometimes they think oh, the doula is there to spy on the work of the nurse and the doctor. But like I said, half of us is not even trained in that work. So you know what I'm saying? Our concern is, of course, yes, to make sure that the client that we're serving is receiving the proper care, mm-hmm. and we're catching little stuff. But most importantly, to make sure that the mom isn't ignored. We all know how healthcare is, right? Sometimes nurses have dozens of patients, right? And sometimes a patient does get ignored. But that's what a doula is there for. If you've noticed that your client has asked for something and it hasn't been given to her in hours, what does a doula do? You go in the halls and you're like, hey, even if it's not her nurse, ask a nurse, right? That might be available. Hey, my client asked for this and that. Are you able to give them this? Because she really needs it. Or if she's in pain, this is a big thing. A lot of Black women, we ask for an epidural or we ask for pain medication and we wait hours to be administered the medication. And sometimes you don't want to make it a racial or a color issue, but it really
It's true.
is. It ends up being that, because for some reason people think that Black women handle pain better, or we're not in as much pain as we say that we are, which is crazy. Like, are you kidding me? Like, so what is it to say, like, Black women, we can
don't
handle
feel pain.
Right, we're like immortal to the pain that happens during childbirth? Like, no, Black or white, like, it's painful. So that's one big thing. And again, going back, that's why doulas are important, because if you ask for something and you want it right now, as busy as it may be on the floor, as doulas, we make sure that we advocate for that. And we note that if it is not given to you at a certain time, to make sure that this is something that doesn't continuously happen. Pain management is important, is very, very important, as you know, Katie.
I agree completely. And on the medical side of things, when I worked in a hospital, that is very true. African American, and if you want pain medication, they will ask you, so why do you think you need it? Have you used this before? So there's like an insinuation that you're a drug addict. I mean, I've seen it. It's not something that I heard. It's not something that I am like making up because of these, reports now. I'm telling you something that I've seen. And it's normally someone of another race that is asking those type of questions. Yeah. So it's a reality, unfortunately. So Afia, I have a very important question for you. How did you, or can you give us an example of how you advocated for yourself as a doula when you were giving birth?
Yeah, so I ended up getting induced. So I went in on a Monday. I had like a typical clinical visit, and then they were like monitoring my the baby, and then they noticed like his heart would like take dips but go back to normal, and it's been happening for like a couple of weeks. And then my blood pressure started going up. Like I said, the unexpected happens. Every week was something new. So the nurse was like, "Oh, the doctor was like to run your baby's test again, the NST." So I'm like, "Okay, whatever." And then she was like, "Wait, let me see what the doctor wants you to do." Okay, they want you to go to labor and delivery and, monitor you for an hour. Boom. When I went into labor and delivery, they was like, "Yeah, girl, you're not leaving. The baby's coming out. Has to come out right now." So they got me set up or whatever, did the COVID swab. I'm like, I just cannot believe I'm going through all of this again in the middle of a pandemic. Had to do the deep nose swab all the way in the back. My head was hurting me for like 10 minutes. Right? And then they got me a room. The room had no windows. And I'm just like, why is there no windows in this room? Like, it feels like a freaking psych ward. And they're like, "Oh, this is the induction room." And I was like, if this is the induction room, there's no reason why there's no windows. How is this at all supposed to help my body make this baby come out? But they kept me in there. They was like, "Oh, once you're like 7, once you're close to delivery, we're gonna move you into, one of the rooms to deliver." Whatever. I was just like, just keep me in here, because I already, as a doula, I know inductions take days, so I'm just like, I'm probably gonna be here for a minute anyway. So my doula came along with my partner. And they had my aromatherapy. I was listening to reggae my whole pregnancy, so they had the reggae. They set the ambiance, chilling. Hospital food was not all that. So luckily my doctor allowed me to eat because I was still early on in the induction. Ladies, that's something very important to know. Not all doctors will let you eat once they start that induction process.
That is true.
But my doctor did, because she knew it was going to be a long journey. So they started giving me medication. They wanted to double up on the balloon and the Cytotec. And I was like, no, let my body do what it do. That was my first step of advocating. Of course, I didn't want to be induced in the first place, but like, when your blood pressure is high, that's something alarming. Like, the baby needs to come out at this point for your health, the baby's health, and all of that. So they started giving me the Cytotec. They'll come in and do the checks. I was like, I'm doing it. No epidural. Yeah, I got this. I'm doing this. And it wasn't bad. So I did end up getting an epidural because I wasn't sleeping. And I have an autoimmune issue even before pregnancy. And I said to myself, if I do not sleep, I'm not going to be able to push the baby out. And it doesn't make any sense to continue to, get contractions every 5 minutes and I'm tired. And then when it comes to the point where I actually need energy, I don't have it. And my autoimmune condition affects me physically being able to push a baby out. So I was like, let me just get the epidural just so I could sleep. I got the epidural. They kept trying to push the balloon on me. I was like, wait, let's see what the Cytotec is doing. Max out the Cytotec. And then if I need the balloon, we will see. So they continued to check me. And finally, I was like 4 centimeters. I was at I think -2 effaced, right? They can touch the baby's head and feel the baby's hair. So I was like, oh, thank God. And then finally my water broke and they were like, okay, we're not going to do no balloon. Bam. Yeah, you need to do the balloon anyways, right? All of a sudden, right? So I was just so happy because I know the balloons sometimes they was like, they put it in for 12 hours. It doesn't really move you much and you're in so much pain. And I'm like, why am I going to put myself through that torture? But unfortunately, after I got the epidural, my water broke and then the baby's heart rate started to take dips and took longer to come up. So my healthcare provider came in and she was just like, all right, the attending physician, that was my provider, came in and was like, okay, we're going to monitor you. We're going to call your doctor. Because one thing I told them is that I only want attendings doing checks on me, vaginal checks on me. And only my physician is to do any medical procedures on me, even if it was the insertion of the balloon, or checking me or cesarean, all of that. And they respected it because I was like, I get what's going on. Y'all need to rush me into, the OR and take this baby out. But my doctor is doing it. And because my doctor wasn't on call that night. So my doctor was like, don't worry, I'm here. They're going to keep me in contact with what's going on. She was like, Afia, I got to go home and put my baby to sleep too. You know that, right? I felt bad, but I'm just like, you don't understand. This is not our plan. And then when, eventually things started going south and it was like, all right, we need to get you in the OR and take this baby out because, you don't want anything to happen to the baby. My doctor came, she was in the hospital. She's like, we're going to do this. She took the baby out. And then she stayed with me after. I wanted to do skin to skin. I told them, I was like, I want my baby, bring my baby here. I want to feed my baby. And she advocated for me. And I was like, oh, when I got into, after surgery, waiting to go upstairs to mom and baby, the baby wasn't there. I was like, where's the baby? And I was like, oh, the baby's in nursery. And then they asked me, oh, can we get the baby formula? Because, his sugar is kind of low. And I was like, why can't you just bring them? And it's like, oh, we can't bring the baby now. So my doctor was like, I told her she can see her baby. You guys need to bring her baby down. It took a couple of hours for them to bring the baby down, but they still brought the baby. And also, I was going through, my blood pressure just kept going up even after he came out. So, at that point, it's like, you have to make smart decisions for yourself. First of all, I was, delirious. I was deliriously in pain. And I kept telling them, I don't know what y'all need to do, but y'all need to give me drugs right now. That part of me started to come out because I was like, y'all need to give me medication. I'm dying right now. Y'all need to figure out some type of pain management for me. So I kept telling my doctor and letting her know. And one thing I tell my doctor today, what I appreciate her for, is that she always listens to me. She is big on reproductive health. I Googled her before I started my journey. I Googled her and I read about her medical history, where she went to school, where she practiced, what she was an advocate for. My doctor is not African American, so ding, ding, ding. You know, it's great to have an African American provider because they can relate to you. But most importantly, it's just great to have a provider who understands the type of care that you are looking for.
Mm-hmm.
That's what's most important, above color and everything. So she understood that. Even before, you know, we made it into delivery, she told me, she was like, I understand. She was like, it's COVID, but I wish I could give you a hug. She was like, I understand. It's okay. I know why you're scared, Afia. You're going to be fine. Like, she created like a multidisciplinary team for me. Because again, like I said, I have an autoimmune disease, and I was also high risk. So she had a high risk doctor for me. She was not a high risk OB, but she had a high risk OB for me. She had me do a consultation with anesthesia before I went into labor and delivery. So everybody knew of my autoimmune condition and how to have a care plan for me. I went into labor and delivery like 2 weeks prior, and there's like, what, to speak with anesthesia, and anesthesia was like, oh, so why are you here? I'm like, well, my doctor said that I have a consultation to speak with you guys, so you guys know what my health concerns are before coming in. So one thing I would like to close out and say is, it's great to have all the support, but as I have been saying, it's important to be your own advocate and be on top of your own health, because doctors are human. You know, I know sometimes people like to see of them as like godly because they have all these knowledge and they treat diseases, but they are human and they have a lot of patience. So you have to do your part in sometimes keeping your care provider on track. Because at the end of the day, you know, technically you are a file, right? They pull up your medical information and look at it for 10-15 minutes before you come into their office. But imagine how many people they're doing that for in a day. So when you come into your visit, of course, a good healthcare provider is going to make sure like they know your case down pat before you even come in. But like I said, they're human and you can't fault them for being human. So you have to be on point. You have to ask them for their contact information and ask them, is it okay to text you? Like, if I have any questions, it's a relationship, right? And as everyone knows, with the relationship, it takes two. It doesn't take one.
Yes.
So you can't put all your trust and all your everything in someone else and think that everything is going to go smoothly. No, you have to make this a true relationship and make sure that you're doing your part to stay healthy through the journey, right? So that doctor can make sure that you are good as well, that you make it out well.
Right.
So definitely that's what I want to say, that you have to be your own advocate. You have to take care of yourself. It is very, very important. And it's something that as a public health professional, why I'm passionate about this work, because it's preventative health. Like, if you take care of yourself, you won't need medical help, right? That's the goal, to take care of yourself, to take care of your health, so that you don't need to go into a system that's already over congested. They're already receiving a whole bunch of people, too many people to care for, right?
Right.
If you don't have to worry about going to, maintain a chronic disease that you have, why not? If it means just eating more vegetables than carbs, right? Or you know what I'm saying? Like, just as an example, like, you can kind of fix the problem at home. So why pay all this money to go to the hospital, right? So that's the goal. And I'm also grateful that, like, the hospital system sees it now. It sees that it's expensive to take care of all these people. Rather, let's invest on preventing people from getting sick, right? So we can save money.
I think it's so important when you think about the community as a whole, because once you can fix a community, you can oftentimes fix a particular issue, right? So also for women here who are interested in becoming a doula, or men, I don't even know if you have male doulas.
Yes, there are doulas for men. Yes, they have doula dads. Men need support too. Yep.
I didn't know that.
Yeah, they have doula dads.
How do they become a doula? I mean, we're in New York. I mean, this is a great metropolitan city. how would they even be able to become a doula? How long is the doula process or the doula course? And I know that you specialize in different areas of being a doula, for example, lactation, postpartum, right? How long is the training to be a doula? And then how long was each specialty training?
Mm-hmm. So there's also bereavance doulas. So for moms who have had miscarriages or stillbirths, yeah, they have bereavance doulas as well, just to add. So honestly, it depends what program you go through. I specifically got trained by Doula International, which is a popular one. In New York City, you know, they have Carriage House and they also have Ancient Song Doula, just to name a couple. And usually when you go through a community doula service, they have, which is Healthy Woman, Healthy Future. That's the program I'm under. They have scholarships that women can apply to become a doula. Like, so if you're kind of like already in the work, you know, as I mentioned, like there are a lot of nurses who already work with mom and baby and want to get trained. We often look for women who are passionate about the work or have a story and interested in doing the work. So you apply for the scholarship. We do a training once a year for both postpartum and birthing separately, as well as dual. So that's what they call full spectrum training. It's based on your schedule, really, because some women, you know, might not have the time to do birthing, but they can do postpartum because it's more flexible. Mm-hmm. Or maybe some women want to do both and kind of like make that like, you know, a full-term thing or a full-time thing. We really have, it's a lot of remixes, I should say, that you can kind of do in regards to what type of doula you have time to be, right? You might be interested in the work, but you can't commit to it 100%. So that's why we have all these options. And like I said, if you go through a program like mine, they have scholarships that you don't have to pay to become a doula. Another thing, so you mentioned how long it takes. Again, depends on who you train through. So Doula International is the certification agency, the training agency that my program uses. One of them. We also use Carriage House and sometimes Asian Songs. But the one that I got trained through was Doula International. And with Doula International, the birthing training was, I believe, 4 days. And each day was like 8 or 9 hours long. Morning to evening, you get like an hour break, and you get a trainer from Doula International to come in and train you on birthing information, right? And then the postpartum is 1 week. The days are shorter though, so you're kind of doing like I believe it was like an 8 to 4, but you're coming Monday through Friday.
Okay.
And they train you on postpartum knowledge. Breastfeeding is heavily based on breastfeeding education. And then once you get trained, your training is good for 2 years. You request an application packet to start your certification. So that's when like the real process starts, because it's a lot into becoming certified. I'm even still going through my certification because I'm fully trained right now, but my certification is something that I just recently started working on last year. It takes a while, but they give you 2 years to complete it. And again, this is Doula International. But if you want to go on a different platform, like I said, Carriage House, they have their own program.
Right.
And Ancient Song Doula, they have their own program. And I'm sure there is a plethora of doula programs out there. Mm-hmm. They're not all free, so you definitely, again, that's something that you have to kind of like stay in tune with and ask questions like, oh, when is it going to be free? Or even if you work for an organization that is willing to pay for these trainings, that's also a great way. That's how I did it, right? I didn't pay a dime. I was fortunate enough to work for these agencies that were advocating for these topics and training staff to become educated in it. And I saw interest in it and I took the opportunity. So definitely ask that work if you're kind of like, in the social service field or clinical field. And then lactation, to become a CLC, a certified lactation counselor, right? That's 5 days. You come in 8 to 4. And then once you're done with the week training, the last day you take an exam. I think it's like 100 questions and 2 videos. You got to make sure that you get at least a 75 and pass both videos.
Oh, wow.
In order to get your certification in lactation consulting. And yeah, that's pretty much it. I'm not too familiar with the bereavance doula. I just know that it's a service that's there to help moms who have lost a child. Yeah, but that's pretty much the process in regards to becoming a doula. Definitely look to see if there's an opportunity where you can apply for a scholarship to do it, because we need doulas, right?
Yes.
So that's why if we see people who are interested, we offer them the opportunity, to show their interest and get trained and actually do the service once they're done.
Yeah. I love it. It's such an ancient practice that's becoming more needed and necessary.
It is.
I love the fact that you do it. I love everything about you, and I love the business, honestly, because it's so important. And women need to be protected and feel comfortable, especially when you're bringing a whole new life into this world.
Yep, for sure.
Thank you so much, Afia. Guys, I will leave Afia's Instagram information down below. The schools, the websites for all the doula information will be in the description box below. Afia, thank you so much.
You're welcome. Thank you for having me.
Oh, you're welcome. I love learning, and I think that this is something that every woman of color needs to know about, that you don't have to be alone. Whether or not you have a partner or not, there's always support there for you. You just need to reach out and ask. Okay, you guys, thank you so much for watching. And until the next video, we want to wish you all the best and take care. Bye-bye.
Yes. Bye. Thank you.